How are you today? Welcome to Whitecoat Medicine Talks. I'm Dr. Carlos Ornedo.
I'm Dr. David Cruz.
And we're here on a special day to talk about what went on yesterday. The first time they've had a day that they're wanting to focus on suicide. A very tough subject, but yesterday, the first time World Suicide Prevention Day.
Yes.
So, this is like a very difficult, complex subject. It's a 10th leading cause of death, and really difficult having an answer of how these things go about. And but we have had some patients that we've seen that have had some type of symptoms that have been observed in patients with suicide. So I think it's important that we bring this subject to you all. It's a very difficult subject to talk about, but I think Dr. Cruz and I feel this is how we're going to reach out to the rest of the public here in Laredo. And in the bottom of this talk, you'll see the suicide hotline number. And I'll say it here, and we'll probably say it again. Anybody that wants to talk to somebody about having thoughts of hurting themselves, there's help. And I want you all to be confident that someone will help you.
Sure. Now we know that there's not one answer for suicide or the things that go along with it. We know that some things are associated with suicide and people that try to commit suicide. That would be depression, anxiety, substance abuse. Of course, there's many more problems than that, and many interrelational problems with other people and dealing with family members, with friends, with enemies, with a lot of people just in general.
Yeah, it's a very tough subject, and like David says, there's no answer, but more than anything else, we wanted to throw it out there that our community in Laredo did some things also to make our community be aware. Some of the things that you have to be looking for, and whoever's out there and sees people looking sad, isolated, looking stressful, sometimes the mind takes over and thoughts go through.
They may even talk about it, and they might even start saying things about suicide, hurting themselves, not caring about life. And you have to pick up on any little cues that they give you and go from there. And if you listen to somebody say something like that, then try to get them help, because that is the most important thing at that point for his or her life, is to try to get them the help that they need so that they can get through that point in their life.
Exactly. Like David says, when you talk to somebody that wants to hurt themselves, the most important thing is listening and try to understand where it's coming from and getting the professional help that they need.
Right.
And once again, we have the number there in the bottom. Those that are feeling sad or depressed and have these suicide thoughts, call that number. We're there to help.
I want to talk a little bit about what we do in clinic, and a lot of times we see a lot of patients every single day, and sometimes we don't have a lot of time to see every single patient that we'd like to see, but we do try to ask those questions and do questionnaires to see if people are depressed, if people want to hurt themselves, if people have thought about hurting themselves. And we try to expand on those things once we see those answers. It's really important to be honest with your doctor and let them know exactly how you're feeling, because that's the only way they can try to help you. And we know there's not one answer for it. We know that giving a person an antidepressant for depression may not be the only answer, but it may help. But listening to somebody else might help you as well. So we can definitely try to get you to a psychiatrist if necessary, a psychologist if necessary, more frequent visits, definitely talk to your family members, talk to friends, do anything that we have to do to make sure that you get through these episodes.
Exactly. And as time goes on, hopefully there's more research and more people looking into why these things happen, because there's going to be multifacets reasons for this. But we'll continue to do the things we do in our daily office and assessment with our patients that come in feeling down and depressed, and we'll continue to work with those.
Definitely, and so some of the things that we may tell you and that we talk about is I always want to make sure that I understand why the person might be feeling that way, and I think it's very important for you to understand why you're feeling that way, not just thinking of hurting yourself or being depressed, but why are you feeling that way, and what are the things that you can do to not feel that way and to get over that. And if we look hard enough, there's a way through everything. And you can't give up on things. You can't give up on life. You can't give up on your friends. You can't give up on family. You can't give up on a lot of different things. And so there's always something to help you through, and there's always someone that will help you through. And if nobody's there to help you through, then you have to help yourself through, because life is more important at this point, and it's always more important. And the only alternative is death, and we don't want that. So we want you to live, we want you to prosper, and we want you to get through a small portion of your life that will then lead to a more fruitful life in the future.
Well said. Again, the number is on the bottom. If you are feeling that way, somebody's there to help you, and we thank you for your time today.
Thank you very much.